fundamentally some basic concept about osteoporosis. Many times, when I look back, when I started my endocrinology, we never talked about diabetes. And in 1983, when I joined Asia, the first thing that Professor Dash asked me to talk about was postmenopausal osteoporosis. He said, this is going to wreck the women in the older age in years to come. We should be ready. At times, a fracture. There is a continuous process of bone remodeling. And this is happening between osteoblast and osteoclast. You have an osteoblast which forms the bone, so the osteoclast which unmakes it. And this whole process goes in a coupled fashion. It's not that whatever you make, you destroy. Whatever the bone mass is a consequence of a synchronized activity of these two cells, which basically predominantly come from the mesenchymal tissue. But it's something like, you are two craftsmen, but they need tools. They need things to work with. They need appropriate nutrients to build this. Half the women in our country who cross menopause will have significant osteopenia. And those aches and pains never go. The risk fractures never go. And almost 1/3 will have significant osteoporosis, which would need treatment, which would need intervention. If you look at this cartoon, just look at it here. Fundamentally, osteoporotic bone, as per the structure, is a normal bone. But the quantum of the bone is lesser. See, it's a bone tissue, but the quantum is lesser. Look at this, the normal architecture. That's the normal bone. And now suddenly, when the bone mass is lost, these trabeculae get lost. So the architecture of the bone is interrupted. One simple lesson for all times to come. The best way to prevent bone loss is first to have a good bone mass. And so you can lose something which you have. And we never have had good bone mass. Bone mass can be acquired only at a particular age. Whatever management you do for osteoporosis, cheap alendronate, moderate zoledronate, costly denosumab, none of them actually ends up giving you a huge bone mass. They protect what you have at that given time. So only thing that you can do is what peak bone mass you achieve in life. Just look at this slide. As we grow, like we grow somatically, our bones also grow, our muscles also grow. And this reaches a plateau. Like our height reaches a plateau, our puberty reaches a plateau. And in a similar fashion, it's not working. Just look at it. This is the time when you acquire maximum bone mass. Late 20s, early 30s, you acquire the maximum bone mass. And if at that time you have lost the opportunity to get the bone mass that your genetics dictates, you are already a loser. Men, women, whoever you are. And thereafter, whatever we do, you start losing the bone like aging. You can reduce the slope of loss of bone. You can slow it down, but you cannot stop it. So one thing that you can do is have the bone mass here that is dictated by the genes that we have. And what are the factors that determine it? These are the non-modifying factors. These are the non-modifiable factors. Like, is a non-modifiable factor, a female is a female and a male is a male. It's a non-modifiable factor that cells might last for a much longer time. But that cannot be changed. But what are the things that can be changed? Look on the left. If you are underweight, fundamentally telling that you are at a great nutritional disadvantage. Today, our published data, India has 35 crore people who are obese. Published data today, we have 60 crore people who are underweight. So you don't expect them to have a bone mass that you desire to be, because there are no muscle, there is no fat, so bone can't say. And one important factor is calcium and vitamin D, not vitamin D alone, calcium and vitamin D. And this needs to be given at the right time. That 500 milligrams of diastatin tablet doesn't help anybody at the age of 75. It hasn't. Even in the younger age, that's a minuscule dose. It needs to be given in time so that at peak you have the best quality bone, and even if 10-20% are lost, 60 or 70 years, still there will be tangible bone that you can protect with whatever things you want to protect. This is one of the first studies we published from the Indian subcontinent almost 2 decades back. It was amazing. Literally mild to moderate vitamin D deficiency all around. 75% of our residents and faculty at Cherry Krishna Institute of Medical Sciences were estimated while vitamin D deficient. 100% of women we estimated while vitamin D deficient. 100%. Young and old. And this is the national data. We thought we are a sunny country, vitamin D would be available. The truth is otherwise. And vitamin D alone, no. It doesn't only doesn't help only calcium and phosphorus. Bone drug, you see, if you look at the structure of 125 dihydroxycholecalciferol, it's a steroid hormone. It is a misnomer. It got caught up in the concept of a vitamin D. Immunomodulator, cardiovascular, but more important is neuromuscular strength. Low vitamin D concentration is associated with impaired calcium absorption. So even if you have a calcium, it doesn't get properly absorbed. Not only that, when calcium does not, first you have a low vitamin D, so you have a problem. Now calcium cannot be reabsorbed from the gut, you have a problem. Now intravascular calcium goes down and secondary hyperparathyroidism comes in. It starts eating at your bone. So it starts causing bone loss right at that very time. It doesn't wait for menopause. It doesn't wait a male to be senile at 70. At that given time, secondary hyperparathyroidism chelates that bone much earlier. Just look at it. We are having an epidemic of diabetes. I don't want to get caught up in that debate here. We'll have it after my talk here. Hyperglycemia, uncontrolled diabetes, insulin, hypoinsulinic state is a hypercalciuric state. They start losing bone. Different mechanisms, then advanced glycation end products, cytokines, and in fact, these advanced glycation end products, they cause dysfunction of osteoblasts, which create bone, which makes bone. So there's an inappropriate activation of osteoblasts. So again, we have a problem. This is a paper that we published on juvenile diabetes some years back. Almost 100% had vitamin D deficiency, because at that time many people thought vitamin D might be responsible for diabetes as well. This is a paper published in Archives of Gynecology and Obstetrics and other research. This year, a systematic review on the impact of nutrition and possible supplementation of many things on bone. Because see, many times we talk about calcium and vitamin D, but calcium and vitamin D will not create bone in a void. You need a scaffold, you need proteins, you need basic matrix on which the bone will be built. And this study did tell us many things. That we need vitamin B6, B12, and of course vitamin D. This vitamin D, we always had a debate in my younger days as an endocrinologist. 100 units, 400 units, 500 units. Now in a postmenopausal lady, 800 to 2000 units are safe. Vitamin D levels of 50, 60 nanograms are safe. 20 nanograms, which I considered all my life as a professor of endocrine normal, is hypovitaminous. So concepts are getting revised. You need iron, you need omega-3, and you need this lycopene. Many of the vegetables that normally we used to eat in the past used to contain that, but we don't any longer. Tomatoes, watermelon, pink grape, papaya, apricot. This study that was published last year, looking at L-carnitine and, see, women generally are homebound. You know, looking in postmenopausal, looking at resistance training, resistance exercises. Men don't do it here. We have an epidemic of every non-communicable disease you think of. But we need to change the way we live. We need to change the way we look at healthcare. It has been shown that every time you do a good L-carnitine and you do these resistant training programs, all those factors that cause osteoblastic activity, the biochemical markers of osteoblastic activity go up. They have the potential of creating a bone, stressing the bone. This is a beautiful paper that this is the crux of this whole stuff, the way I look at it. The effect of calcium supplementation under 35. It's a systemic analysis, review and meta-analysis of many studies done over decades. And in short, if you look at it, many methods were used, methods were homogenized, but ultimately what comes back as a conclusion? Authors conclude, whatever we do, the basic insight in evidence suggests that calcium supplementation, we showed that calcium supplementation significantly improves bone mass, implying that preventive calcium supplementation before or around the age when you achieve peak bone mass. That peak bone mass starts gathering momentum from 18 and is done with by the age of 35. Nothing happens after that. Aging is aging, it cannot be reversed. So, when you peak in your life, you need to have the best possible health. If you don't have, so that time, you see, imagine now the vagaries of being a vagabond at the age of 18 to 20, men, women, boys and girls, wouldn't be taken care of them. All the tissues in young women are today taken care of by adipocytes, not by the muscle, not by the bone. And you see the consequences of that. So this one insight is catch girls, and in fact boys as well, catch girls at that right time so that they have the maximum bone that their genetics dictates. People are looking at vitamin. This was a paper from people from Latin America. That what is the impact of vitamin C? Quite new insights, yes. Probably you need to have a more consolidated, not calcium alone, not vitamin D alone. The two are primary. Two are number one and number two. But there are too many. It's something like, you look at coronary artery disease. Lipids are number one. Hypertension is number two. Diabetes is number three. Cigarette smoking tops all three of them. So there are many, so everything needs to be taken care of. Not, you got a hemoglobin A1C of 6, nothing is protected. If you have hypertension, which is in control. If you have a lipids, LDL of 200. If you still are using cigarettes, 2 packs a day. So in consolidation, that needs to happen collectively. Microbiome. The type of the gut microorganisms has got a huge attention in the last 1 decade. The gut is the portal to the body. Everything goes in there. I wouldn't get into the data that is coming, but I'll tell you one thing. Whenever we take vitamin D, it has to cross the barrier of the gut. It has to go in. Whenever we give vitamin D, it has to go into the intravascular compartment. It has to get activated in liver. 25-hydroxycholecalciferol. It has to get activated into 1,25-dihydroxycalciferol. All along, we thought it was only happening in the kidney, predominantly happening in the kidney, but happening everywhere else. Not a topic of the day. And if, when you have this abnormal microbiome, this 1,25-dihydroxycholecalciferol ultimately acts on the vitamin D gut receptors to reabsorb vitamin D. And this absorbability is disrupted. See, something like we call insulin resistance. That sort of a resistance you face in absorption of the calcium when you have this vitamin D there. So people have tried to identify organisms that do it. See, investigators identified 8 specific taxa. Taxa is a group of genus, not getting it. Many from the phylum Firmicutes that positively are correlated with the levels of calcium. Over a millennia, there has developed a symbiotic relation between our gut microbe. I was amazed to know that we have quite a few million varieties of microbes in the gut. And they seem to be helping with vitamin D also. Now, apart from this, citrides optimize musculoskeletal health. So, bone just cannot do a good job if muscles are not there. As we age, it's not only the bones get into the rough weather. Sarcopenia is extremely common in old persons in India. So if muscle mass is not there, the joints will be dysfunctional. That's what it says. Before I walk off, this is the data that, US, they do different studies over decade, data in different areas. Now, ever since this coronary artery disease, dyslipidemia, metabolic dysfunction, atherosclerotic fatty liver disease came to the fore, many people have been promoting different fat foods, and in US, some groups are taking weird vegetarian diets. And this showed that all of them have wrecked bones. So we do not indiscriminately need to emulate whatever comes from the Western world. We already have a colossal problem of diabetes, coronary artery disease because of acquiring some of those habits. Just look at it before I wind up. 33% in US during pregnancy have vitamin D deficiency. 60% in India. You can see this is pregnancy, when today everybody is given calcium, vitamin D, calcium, vitamin D. Peak bone mass. That peak bone mass starts gathering momentum from 18 and is done with by the age of 35. Nothing happens after that. Aging is aging, it cannot be reversed. So, when you peak in your life, you need to have the best possible health. If you don't have, so that time average, imagine now the vagaries of being a vagabond at the age of 18 to 20, men, women, boys and girls, wouldn't be taken care of that. All the tissues in young women are today taken care of by adipocytes, not by the muscle, not by the bone. And you see the consequences of that. So this one insight is catch girls, and in fact boys as well, catch girls at that right time so that they have the maximum bone that their genetics dictates. People are looking at vitamin. This was a paper from people from Latin America. That what is the impact of vitamin C? Quite new insights, yes. Probably you need to have a more consolidated, not calcium alone, not vitamin D alone. The two are primary. Two are number one and number two. But there are too many. It's something like, you look at coronary artery disease. Lipids are number one. Hypertension is number two. Diabetes is number three. Cigarette smoking tops all three of them. So there are many, so everything needs to be taken care of. Not, you got a hemoglobin A1C of 6, nothing is protected. If you have hypertension which is in control. If you have a lipids LDL of 200, if you still are using cigarettes 2 packs a day. So in consolidation, that needs to happen collectively. Microbiome, the type of the gut microorganisms has got a huge attention in the last 1 decade. The gut is the portal to the body. Everything goes in there. I wouldn't get into the data that is coming, but I'll tell you one thing. Whenever we take vitamin D, it has to cross the barrier of the gut. It has to go in. Whenever we give vitamin D, it has to go into the intravascular compartment. It has to get activated in liver. 25-hydroxycholecalciferol. It has to get activated into 125-dihydroxycalciferol. All along, we thought it was only happening in the kidney, predominantly happening in the kidney, but happening everywhere else. Not a topic of the day. And if, when you have this abnormal microbiome, this 125-dihydroxycholecalciferol ultimately acts on the vitamin D gut receptors to reabsorb vitamin D. And this absorbability is disrupted. See, something like we call insulin resistance. That sort of a resistance you face in absorption of the calcium when you have this vitamin D there. So people have tried to identify organisms that do it. See, investigators identified 8 specific taxa. Taxa is a group of genus, not getting it. Many from the phylum Firmicutes that positively are correlated with the levels of calcium. Over a millennia, there has developed a symbiotic relation between our gut microbe. I was amazed to know that we have quite a few million varieties of microbes in the gut. And they seem to be helping with vitamin D also. Now, apart from this, citrides optimize musculoskeletal health. So, bone just cannot do a good job if muscles are not there. As we age, it's not only the bones get into the rough weather. Sarcopenia is extremely common in old persons in India. So if muscle mass is not there, the joints will be dysfunctional. That's what it says. Before I walk off, this is the data that, US, they do different studies over decade, data in different areas. Now, ever since this coronary artery disease, dyslipidemia, metabolic dysfunction, atherosclerotic fatty liver disease came to the fore, many people have been promoting different fat foods, and in US, some groups are taking weird vegetarian diets. And this showed that all of them have wrecked bones. So we do not indiscriminately need to emulate whatever comes from the Western world. We already have a colossal problem of diabetes, coronary artery disease because of acquiring some of those habits. Just look at it before I wind up. 33% in US during pregnancy have vitamin D deficiency. 60% in India. You can see this is pregnancy, when today everybody is given calcium, vitamin D, calcium, vitamin D. Project them till you have them. The moment they're gone, they are a history. They have to be written in the history book. If this process cannot be undone. Thank you so much. Technologically, it is believed that if you have nanoparticles, their absorbability is better. But I'll tell you honestly, you know the mushrooming of the industry in the country. And the quality care is not same, quality control is not same. And vitamin D, everyone making lock, stock and barrel. But yes, I always presume that if you give vitamin D at different times, keep on changing the source of the vitamin D in this belief that someday you might hit a vitamin D which is really relevant and good. I know, my daughter works with me. She says, Baba, sometimes you write this particular brand A, then suddenly it becomes a C. I said down the line, I believe that somewhere down the line, destiny might hit doctor and the patient, and good drug might come to. At least if we give her 1 year, 3-4 months, she might get a good drug. So it's our responsibility also to determine how to find those good drugs in the market. I cannot and I won't elaborate beyond that. It will not be legally appropriate.
Sir, just in the continuation of this question, many of our orthopedician clinic colleagues used to write vitamin D injectable 6 lakh units and in a huge doses. What's your opinion about it? Where it used to be written injectable?
Yes, your colleagues do that, but they ultimately come to us for hypercalcemia and the consequences. I was a big fan of those 60 lakh injections in 80s. But somewhere down the line, when the problem started coming back to us only, in 90s, we stopped. I was one of the first who motivated people to create these 60 unit sachet. You just cannot overdo it. I'll tell you where the problem lies. Problem is not in injection. Problem is not in the quantity of that. Problem is in poor education. डॉक्टर साहब वो इंजेक्शन लिया था तो फर्क हो गया. अब कान में दर्द है तो विटामिन डी के 4 इंजेक्शन लिए, कमर में दर्द है डिस्क तो 4 इंजेक्शन लिए. That unregulated use is not warranted because nobody asks a doctor that. It's something like what happens to paracetamol, something that happens to an antibiotic in our country. And I've seen too many renal failures actually because they got admitted in endocrinology because of hypercalcemia. Think of primary hyperparathyroidism.